what is your experience in hair surgery, where you come from, what you are doing, and we will discuss everything.
Okay, thank you. You are welcome. Now, yeah, I already performed hair surgery for over 27 years this year, and I try to perform all type of techniques, especially FUE, FUE micromotor, FUE manual, FUE long hair, and very rarely I say FUT. So why I prefer to perform every type of technique? Because according to my experience, uh, we have to know all techniques, and we have to choose the right technique according to the patient. Because every technique has different advantages and different disadvantages. So if you don't know all of them, you have no chance to compare and decide the exact technique for the patient. So this is the reason I prefer to perform all of them and try to choose the best one for the specific patients. And what else? As you know, I'm a little bit careful about the legal points, and I prefer to perform surgery in legal ways. It means that I have a licensed clinic, and all the team members are nurses and anesthetic technicians, and it means that this is very valuable for me, and I try to give my best to my patients.
Um, Coming to your clinic, because I saw you are a smaller clinic. I think it's important also a lot for our visitors. You are a doctor orientated clinic. That means what steps exactly you do and what steps do your nurses do.
Okay, I'm trying to involve the surgery as much as possible, and especially the legal points and the critical points. Uh, my approach is this. As you know, we prefer to do online consultations at the beginning. So it needs that I prefer to do as much as possible online consultation with the patient before they come here. And this is completely free. They don't pay anything. When they touch in contact to my interpreters, they get the general information from that. But if they want specific information according to their situation, of course we ask online consultation. After that, they have to come one day before the surgery, and my team has to prepare them. We have to do some blood works, electrocardiogram, and the surgery day. Of course, if they been time, I prefer to do consultation one day before, and so I want to examine, I want to check the patients, and I want to use the Zico app, and so I want to see every detail related with the patient one day before the surgery. That's my prefer, if it is possible. If not, we do them in the surgery day, and also I draw their hairline. I listen them. I try to understand them. They have enough time to understand me, to criticize what we can do, what we cannot do, and I try to explain the limits of surgery because this is so valuable. We are not limitless doctors, and the patient's donor and the patient's expectations cannot be limitless. So we have to clarify the limits. We have to understand each other. I try to understand the expectation of the patients, and I try to show the realities and how much I can afford their expectations. And it takes time, I have to say. And we have no limitation like with the time. Then I draw the hairline. We discuss. We have enough time because they are the only patient all day. I am not in rush. I'm not in rush, and they are going to be the only patient. And we discuss in their line. Then if the technique is shaven, we are going to shave the hair. The technicians, the nurses, they are going to help them. Interpreters. Then they go to the surgery room, and what we do first, the nurses are going to prepare them. They are going to do the disinfection of the hairs, again some checklists before the surgery, before the anesthesia. We have to monitor them before the anesthesia. Everything should be clarified in the surgery room again. and last checks, that anesthesia, and the preparation part is finished in that point. Then the extraction part. Extraction part means extraction, harvesting, collecting, counting, registering, microscopy. And 4 nurses, at least 3, generally 4 nurses, are going to help me in that part. I will do their harvesting, they will do the rest. And my patients are awake. It means that they are going to see who is doing each part. And I can easily share that we have chance to record every surgery from the beginning to the end. And it means that if they want to see who is done which part, they have chance to see it easily. So I will do their extractions and I will do their incisions, and the nurses are going to do collecting, counting, registering, microscoping, assisting of me. And if anything changes in that position, of course, we inform the patients. We say that, look, I want to do the collecting now. Okay, there is no limitation for me. If I feel, if I have time, if the nurses need that, I also can do the collecting. I want to do surgery, so there is no limitation. But if anything changes out of routine, we inform the patients. The last part is placing the grips. Only the nurses do it. But sometimes is it not promised? Sometimes I love to perform surgery. I can place, but it is not promised. 100% generally they do it, but extraordinarily I can do it, and there is no limitation. So these are the parts in my career.
Typically, your nurses will place the grass. I mean, you make the slits. They will put them inside, which is a legal conform. And then you have a checkup after the day, what is happening, or the day after. You will see the patient again, I guess.
Yes. No, this is, I had said that this is the most common question. They ask me all of the patients, maybe 90 of the patients. Okay, Dr. Biçer, now this is 3 or 4 o'clock. Your parts are finished, but the surgery is not finished, and the nurses are going to place the grafts. Are you going to leave me? No, 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 no. You have no chance. You have no chance, and I have no chance, I have to say. We are going to leave the clinic together. And I have to say that I can't leave the clinic maybe 5 or 10 minutes later than you, because I want to check everything after that also. And I will check everything. Why? Because it's a serious job for me. I can do the exact parts, but the rest I'm doctor, and I know that everything may happen before, during, and after the surgery, and I am ready every time for the worst scenario. So I have no chance to go out somewhere to my home. No, no, but I don't complain. I'm happy to be with you.